So we are here to speak today about the new compounds that are coming for drug development, specifically in target therapies and immunotherapies. In target therapy in ASCO this year were important communications. The first one was the RET inhibitor. The new compound is called LOXO-292, and this compound demonstrates an important activity in different alterations or aberrations of RET, specifically in fusions of RET that are frequently found in thyroid cancers. Around 20% of the patients have this kind of fusions. The response rates were about 77% in this population. Specifically also in lung cancer, that we found fusions of RET in 2% of the patients, important and high response rate, and also is regardless, this kind of alterations that regardless the kind of fusions have a benefit with this compound. For RET mutations also, they demonstrate an important activity, and that's kind of mutations we found in medullary tumors, medullary thyroid cancer, for example. And the activity was also very high, 45% for a very aggressive disease. Other compounds that were presented in ASCO this year is also a new NTRK ALK and ROS inhibitor, similar to entrectinib, that is a repotrectinib. This compound demonstrates also important activity in ALK translocation, in ROS fusions, and that was around 70%. New compounds also targeting HER2 and HER3 were presented. Specifically, there is a new compound that is called CW25, and this compound is a kind of new engineering in the composition of the drug that is able to cover the two epitopes. That's the epitopes that is working for trastuzumab and for pertuzumab. So in this way, the response rate in very heavy pretreated patients in HER2 positive were very impressive. We presented personally from our university data coming from another compound in heavy pretreated patients in HER2 mutation, in HER2 amplification. Actually, there were also patients that we call triple negative because they have an immunohistochemistry at 1%, and in these patients, this new compound was also able to have an important response. Regarding to immunotherapy, new compounds in immunotherapy, but I would like to refer to one specific that is an anti-PD-L1 in combination with a trap for TGF-β, and this compound is a bifunctional compound demonstrating important activity in HPV positive tumors. For example, anal carcinoma, cervical carcinoma, and head and neck cancers. Finally, a new compound that is also interesting to speak about is cell therapies regarding to a special type of sarcoma that is a myxoid and round cells sarcomas, and this compound that is prevent also the manipulation of these cells of the patients, and the reinfusion after an induction of chemotherapy demonstrate an important activity. So there are very important promising activities for drugs coming for our patients in target therapies and immunotherapy. Another important news is coming also for the drivers. So that's important to remember to our colleagues that when you have a patient, specifically in lung cancer, with different drivers like RET, MET, ROS, ALK, or EGFR, we need to test these kind of drivers because we are using now immunotherapy and these patients are not responding like we expected. So for example, I explained before, RET, the compounds LOXO, demonstrated an activity of 77%, but when these patients are treated, and that was an experiment presented this year by the French group, when these patients are treated with an anti-PD-L1, the response rate is 6%. So we need to be very careful and remind that we need to test all the patients for driver mutations before we start an immunotherapy, and that's an important message. Thank you.